Y'all know dick calls is mandatory?
All right, let's look at the 13, the lower leg and the ankle. We're going to do the peroneus brevis. The peroneus brevis is this small muscle right here on the lateral side, okay, of the lower leg. It is near the fibula, okay, and it's a muscle that can kind of come down and it causes eversion, okay, and external rotation. Okay, number 14 is the tibia. The tibia is the large bone in the lower leg. It is your shin. Okay, if you're not sure the tibia, it's on the medial side. So if we look here, on this item, it's number 74. Okay, but it is this bone right here, your tibia. Your fibula is the small bone on the lateral side. Okay, when we talk about 16 and 17, that is your anterior compartment and lateral compartment. If you guys, what we're referring to is the different areas in the lower leg. Okay, so the anterior compartment composes of muscles in the front. So your tibialis anterior, as well as like the the tibialis posterior. Okay, but it's referring to muscles and the blood vessels kind of within there. If we were to cut the leg, okay, in half.
What is this compartment?
Yeah, that's the compartment. The anterior compartment, so really is just this front area right here. The lateral compartment is just the area on the side, like it says. So it's the muscles that are on the outside of the leg, okay, around the fibula. Number 18 is the tibial tuberosity. The tibial tuberosity, and you all can feel it right now if you want to. It's right below your kneecap. Okay, it is the bump on the tibia. Some of you have a large bump there from when you were a kid. The patellar tendon attaches to that spot, and as you're growing, some people will get pain there, especially if they get tall. Somebody like basketball players, as they grow, some of them will grow 6-7 inches in the summer. You'll start to see that bump grow because the muscle is pulling on that and it's actually having to lay more bone cells down. But it's on the tibial tuberosity, this bump right here. The head of the fibula. The head of the fibula is up on top. Okay, the proximal side of the fibula. Right where this metal piece is going in, that is your fibular head. Kind of right in this area here. And you can feel it right on the side. Okay, so right about here. We have the patella. The patella is your kneecap. Okay, make sure you know that bone. The lateral collateral ligament is on the lateral side. It is most of us may have heard of it, it's called like the LCL, okay, that ligament. But this is the outside of the leg. It goes from the femur to the fibula. The medial collateral ligament is opposite of that. It goes from the femur to the tibia. But the collateral ligaments are on the outsides. Outside and inside, or on the sides. The anterior cruciate ligament is deep inside the knee joint. Okay, on this model here, we can't see it. Okay, but it's really behind, if we look at the femur, okay, and the tibia, it is stopping the tibia from going forward. Okay, it's stopping the lower leg from going forward. The posterior cruciate ligament, or the PCL, that is stopping the lower leg, the tibia, from going backwards. Medial meniscus and lateral meniscus, those are the pads that sit on top of the tibia.
The where?
Sit on top of the tibia, the meniscus.
Oh, wait, where's it at?
Okay, in the joint line.
Right here.
Okay. Yes.
How did I know that? I'm so smart.
Right there. You can feel it a little bit.
So what's this, like right here?
Okay. That is your tibial
right here.
tuberosity. That's your patella.
Patella.
This?
Yes.
Yeah,
The lateral and medial epicondyle, that is referring, okay, to up here, okay, on the femur. Okay, so what is important when you're doing the lower leg is being able to identify what we call where the joint line is. And if each of you feel on your own knee and you find the patella and you there's a natural like crevice or divot where the patellar goes down, start going around the side and you can feel where the two bones meet and you can feel that little gap. The lateral epicondyle is on the lateral side. The medial is on the inside. A little bit farther farther down, or farther like towards the back.